Imagine waking up every day feeling sluggish, your skin dry, your heart pounding slower than usual, and your mind foggy. For many people with hypothyroidism, this is the norm, and managing it becomes a daily struggle. Thyroid medications like levothyroxine often provide relief, keeping these symptoms in check. But what happens when you're considering stopping the medication or lowering the dose? Is it safe? Could those dreaded symptoms return? If you've ever asked yourself these questions, you're not alone. The role of thyroid medication, why it's essential. Let's start with the basics. Thyroid medication, especially levothyroxine, is a cornerstone of treating hypothyroidism. It's not habit-forming, and it's designed to replace the hormone your body can't produce on its own. Think of it like putting fuel in a car. It keeps everything running smoothly. Without it, the body struggles to function properly. This medication helps balance your thyroid levels, ensuring you have the energy you need, your heart beats at the right pace, and your mind stays sharp. For most people, stopping thyroid medication suddenly isn't a great idea. Your thyroid isn't magically fixed just because you feel better. If you stop or reduce the medication too quickly, it's like taking that fuel away from the engine. You'll likely see those frustrating symptoms creep back in. When might you consider weaning off thyroid medication? There are situations where weaning off thyroid medication might be appropriate. For instance, if your thyroid issues were temporary, such as during pregnancy, your body might no longer need the extra hormone support. Or, if you've lost weight or made significant health changes, your medication dose may need adjusting. But before you make any changes, it's crucial to talk to your doctor and run some tests. Your doctor will likely suggest a thyroid panel. This blood test measures how well your thyroid is working and checks your thyroid-stimulating hormone, TSH, levels. If your TSH levels are low, it could indicate that your medication dose is too high, and your body is getting too much of the hormone. In contrast, normal TSH levels might signal that reducing your dose is safe. The process of weaning off, slow and steady, wins the race. When it comes to weaning off thyroid medication, it's not something that happens overnight. It takes around 4 to 6 weeks for the medication to fully leave your system. During this time, your TSH levels will gradually rise to where they would be without the extra hormone. That's why doctors recommend adjusting the dosage slowly, typically in small increments over a period of weeks or months. The goal here is balance. Your doctor will adjust the dose based on your lab results and any symptoms you report. After about 4 to 6 weeks, another thyroid panel will give a clearer picture of how your body is adjusting. If you start noticing any of the classic hypothyroidism symptoms like dry skin, brain fog, or unexplained fatigue during this process, it's a sign that your body may still need the medication, or at least a higher dose. Signs your dose is too high: recognizing hyperthyroidism symptoms. While the goal of thyroid medication is to treat hypothyroidism, taking too much can swing the pendulum in the other direction, causing hyperthyroidism. This means your thyroid becomes overactive, and you may notice symptoms like a racing heart, feeling anxious, sweating more than usual, or struggling with insomnia. If you've been feeling like you're in overdrive, it's worth checking in with your doctor, as lowering the dosage could help bring you back to normal. People experiencing factitious hyperthyroidism caused by too much thyroid medication often see these symptoms improve as the dose is reduced. In time, you may feel less jittery, your heart rate might slow down, and you'll likely sleep better. Listening to your body, what to expect during the process. The idea of weaning off thyroid medication can feel daunting, but the truth is, it's all about listening to your body. If your symptoms improve as your dose is lowered, that's great. But if you notice the return of hypothyroid symptoms like weight gain, low energy, depression, or even a slow heart rate, it might be a sign that your body still needs some level of support. It's also important to remember that these changes won't happen overnight. Symptoms often appear slowly, sometimes over weeks. Keeping track of how you're feeling and noting any new changes can help both you and your doctor adjust your plan as needed. Understanding the root cause, iodine, diet, and hypothyroidism. When talking about thyroid health, it's essential to understand what causes hypothyroidism in the first place. Globally, inadequate iodine consumption is the leading cause, but in countries like the United States, Hashimoto's thyroiditis, an autoimmune condition, is the primary culprit. Iodine is crucial for thyroid function, and while it's found in foods like seaweed, fish, eggs, and iodized salt, most people in developed countries get enough iodine from their diet. As a result, dietary changes are rarely recommended as a primary treatment for hypothyroidism. While some studies suggest that certain diets, like gluten-free eating, might improve thyroid function, there's no solid evidence that diet alone can replace thyroid medication. Strategies for successfully weaning off thyroid medication. If you're considering weaning off thyroid medication, there are a few strategies that can help make the process smoother. 1. Lifestyle adjustments. While lifestyle changes can't cure hypothyroidism, they can help manage the side effects. Exercise and a balanced diet can offset some of the cardiovascular risks associated with thyroid disease, such as high cholesterol. 2. Monitoring symptoms. Track how your symptoms change over time. Hypothyroid symptoms won't appear right away, and hyperthyroid symptoms may not disappear immediately either. Being patient and paying close attention to your body's signals is key. 3. Regular checkups. Work closely with your healthcare provider. Regular thyroid tests at each stage of dose reduction can help ensure that you're on the right track. 4. Acceptance. Sometimes, despite your best efforts, it might not be the right time to wean off medication. That's okay. There's no rush, and there's no reason to avoid thyroid medication if your body still needs it. 5. Doctor supervision. Finally, always make these changes with the help of a doctor. Lowering your dose too quickly or without medical supervision could trigger health issues or worsen your thyroid function. Conclusion: is it safe to stop thyroid medication? Thyroid medication, like levothyroxine, is a safe and effective way to manage hypothyroidism. For many people, it's a lifelong treatment. However, if your thyroid function improves or your circumstances change, it may be possible to lower your dosage or even stop medication altogether with the right medical guidance. But remember, stopping thyroid medication is a serious decision that should only be made for the right reasons and under a doctor's care. With proper monitoring, it's possible to make adjustments safely. In the end, it's all about finding the right balance for your body and your health. Whether you continue with your current dose or decide to reduce it, the key is working closely with your healthcare team to ensure the best possible outcome.